So here in the hyperthyroidism, we will see the hyperthyroidism now. So overproduction of the T3 and T4 leads to produce hyperthyroidism. Okay, what are the causes of hyperthyroidism in which T3 and T4 are increased? So first of all, the Graves disease, okay, which is autoimmune thyroid disease, result from the production of TSH receptor stimulating antibodies, result from the production of the TSH receptor stimulating antibodies. Okay, most common cause of hyperthyroidism. It is the most common cause of the hyperthyroidism in which the production of the TSH receptor will be receptor stimulating antibodies are produced. Okay, uh, then the nodular thyroid disease. Nodular thyroid disease results from the autonomous secretion of the T3 and or T4 either from a solitary toxic nodule or numerous nodules within the multinodular goiter. Then the second most common, this is the second most common, this is the most common Graves disease, then the nodular thyroid disease and the thyroiditis. Example are viral thyroiditis, then postpartum or drugs. So results from the inflammation of the thyroid gland causing the destructive release of the thyroxine. This is the very less common. Okay, so first of all the Graves disease, okay, then the nodular thyroid disease and the thyroiditis. Okay, so what happened that in the Graves disease the production of the TSH receptor stimulating antibodies will be there, and it is most common. Then in the nodular thyroid disease the T3 and T4 secretion will be increased due to solitary toxic nodule or the multinodular goiter. And the thyroiditis, this is it is the viral or postpartum or drug induced, in which there is the inflammation of the thyroid gland and causing destructive release of the thyroxine. It is very less common. Then what is the clinical features? So in the clinical features, the symptoms are the weight loss, then the insomnia, irritability and anxiety. Okay, uh, then heat intolerance, uh, okay, then palpitation, tremor, pruritus, then increased bowel frequency and loose motion, then the menstrual disturbance and the reduced fertility. Okay, that is the weight loss, often with the increased appetite, then the insomnia, irritability and the anxiety, heat intolerance, palpitation, tremor, pruritus, then increased bowel frequency and loose motion, then the menstrual disturbance and the reduced fertility. Then which are the signs? Uh, general, there is a resting tachycardia, sinus rhythm or atrial fibrillation, then the warm peripheries, then proximal myopathy, resting tremor, hyperreflexia, then lead leg, then hypertension and flow murmur. Okay, hypertension and the flow murmur and the agitation and the restlessness, goiter. Okay, Graves disease. In the Graves disease, there is the thyroid eye disease. In order of increasing severity, there is a thyroid eye disease. Okay, in the Graves disease. Then investigations. So we have to do the T3, T4, and the TSH. Elevated T4 or and T3 with suppressed TSH is the primary hyperthyroidism. Then elevated T3 with suppressed TSH, T3, TSH and T3 uh, toxicosis with suppressed, okay, with suppressed TSH, it is due to T3 toxicity. Then the normal T4 T3 with suppressed TSH is a subclinical hyperthyroidism, and elevated T4 T3 with non-suppressed TSH is considered as a, means that T3 T4 is elevated and the TSH is also elevated, consider as a interference or secondary hyperthyroidism, that is the TSH-noma or thyroid hormone resistance. Okay, then thyroid antibodies, thyroid peroxidase TPO and the TSH receptor stimulating antibodies. Then the thyroid ultrasound scan and the nuclear imaging, technetium or iodine uptake isotope scan. Okay, that we have to do. Then management, anti-thyroid medicine, uh, thionides, that are the carbimazole and propylthiouracil reduce the synthesis of the T3 and the T4, can be used in a titration or block and replace regimen. Then the beta blocker can be used to control the symptoms until patient becomes euthyroid. Okay, then the definitive treatment is the surgery and radioactive iodine. Okay, what is the thyroid storm? So this is a rare medical emergency. Okay, thyroid storm is the medical emergency that present with uh, high high output cardiac failure and the extreme agitation. Okay, cardiac failure and the extreme agitation. It has a high mortality and requires high dependency care. Okay.